actually a pretty simple process in which I will ask you a few questions and try to get to the bottom of what your automatic negative thoughts are. Automatic negative thoughts are thoughts that we all have that sort of spring sometimes to the front of your mind and sometimes unnoticeably to the back of your mind, and it can really affect the trajectory of the rest of your day. So an example is kind of like this. When we're feeling okay and things are relatively all right, you may have between 5 to 20 automatic negative thoughts a day. But when depression, anxiety, or addiction, or all three starts to creep into our lives, that can look very different. There can be 100 and upwards of 1,000 automatic negative thoughts that are constantly recycling and spinning like a vortex in your head, often going unnoticed for years. The effects of that are actually pretty devastating. So imagine if you have 10 negative automatic thoughts in one day. Each time you have an automatic negative thought, it produces a negative feeling. That feeling might be sadness, it might be anger, it might be fear. After you have the automatic negative thought, it creates the feeling, which is then, in a way, haphazardly sort of absorbed into your psyche. You brush it off and try to go on with the rest of your day. But when you're dealing with depression, anxiety, or addiction, and that's happening 1,000 times a day, you're then tasked with absorbing repeatedly all of those negative emotions over and over again throughout the day, the week, the month, and then at the end of the year. This is why sometimes patients come in after a long period of time really not functioning very well and at their wits' end.